Hello and welcome to the first episode of SpeakUp at FOM podcast, where we engage in real conversations, real impact with experts from the Faculty of Medicine, Universiti Malaya. Broadcasting from the studio at Public Health at we bring insightful discussions to the community, helping people to learn, reflect and advocate on key health issues on behalf of us. My name is Dr. Ika Muhammad Saleh and I'm your host today. First ever podcast. Never in my life have done this before, but truly honored to have the first one as our special guest, the Dean of the Faculty, Professor Datuk Dr. Yang Farida Abdul Aziz. How are you, Prof. Yang? Welcome to the show.
I am very well, and if you're anxious, then I think I'm a little bit anxious too, because this is probably a first for us, right?
Yes.
To do this for Faculty of Medicine, our beloved faculty. So a lot of pressure, but I think we're going to have fun with having real conversation, hopefully creating real impact.
Hopefully, yes. We'll ace this. Yeah. So good to have you here. Thank you for supporting this initiative.
Thank you for inviting me.
Right. So now for our first segment, it's called From Colonial Roots to Local Impact. How is UM reinventing medical education? And we've always known UM as a leader in medical education, but its journey started way back in 1905 as the King Edward VII College of Medicine. So back then, what I've read, the focus was on serving a British colonial interest, training a small elite workforce, mostly for urban hospitals. Now we're fast forwarding to 2025, 20 years later, Prof, 120 years later. So Malaysia is now an independent nation and with its own vision for healthcare. So how has the faculty evolved since those early days? How do its values today reflect Malaysia's identity and also healthcare priorities?
Yes, I think you are very right, because Universiti Malaya was built on our colonial days, and as you mentioned, 1905 we started a long time ago. That's our legacy and our birth. But it wasn't until 1959 that there was a clear decision that National University of Singapore and Universiti Malaya should be two autonomous campus, and we actually moved to Kuala Lumpur, Malaysia. And our first dean ever was Tan Sri Emeritus Professor TJ Danaraj, again a beloved icon of this faculty. And he was the dean in 1963. And the first batch of medical students entered the door of Universiti Malaya Faculty of Medicine in 1964. And coincidentally, 64 medical students were admitted then, and they graduated. The first batch ever graduated was in 1969. Now, if you were to look at the history of Universiti Malaya, yes, we started in the colonial era, but all the deans of the medical faculty actually had been Malaysians. Starting from Tan Sri TJ Danaraj, who was born in Perak, and me, born in Malaysia as well. So we have always had the tradition of having the faculty being helmed by Malaysians, creating programs for Malaysians. So we've always been rooted in Malaysia. So when you talk about moving from those era to now, a big part of medical education the world over have been talking about decolonization of medical education, because I think we need to understand that from the time when the curriculum were focused on diseases that were seen in the Western countries, currently, our curriculum, our research focus and our patient care very focused on what is relevant in our region, in our nation and for our communities. And one of the departments that's making sure that we do it is the very department in which this podcast is happening, which is the Department of Social Preventive Medicine. Medicine is not just about curing. We first start with prevention. And I think we've always been focused on that. So if I can say, the curriculum has shifted and we have decolonized with a focus on relevant issues, relevant activities and processes that focuses on the needs of our nation in Malaysia regionally as well. So there's a big shift to there's a big shift into decolonization.
Right. So agree with you that we're moving away from Western-centric frameworks that kind of overlook local disease burdens and also healthcare access issues, and perhaps also traditional medicine, which we try and address as well. So one of the ways Malaysia has addressed the inequalities is through initiatives like the Sistem Ambilan Tertinggi University, or what we know as SATU, which ensures that students from all backgrounds, the rural, the underprivileged areas, have equal opportunities to enter medical school. So from your perspective, how has the SATU system helped to make our medical education more inclusive?
Okay, I wouldn't say it is the SATU in particular. So Universiti Malaya, since its inception, had always been a public university. We still have a strong funding from Malaysia government, and we have the way in which aspiring doctors can enter into the system are through three major different routes, I would say. The first is through the Perdana route. Now, these will be Malaysians, and we focus on getting the best of the best, very, very competitive. We rank them and we admit them into Universiti Malaya. We then have the SATU program, which is the Sistem Terbuka Universiti Malaya. Now, the SATU program opens this up to people who can pay a little bit more into entering UM, and again, very competitive, we rank them. We also have opened international candidates, so people from outside of Malaysia can enter Universiti Malaya. Now, you have to understand, university are being number 60 in the world based on QS ranking. We give one of the best medical education in this region, if not the world. So we are hoping that we can train more people from all over, not just Malaysians, but also people outside of Malaysia. But in terms of what you're asking, inclusivity, diversity, equity, these are very tenets of Universiti Malaya. We actually have a code of ethics in the 1970s that was done by Universiti Malaya, and we stand by that. So when we bring in students or aspiring applicants into the faculty, we make sure that we do not base it on race, color, religion, sexual preferences. We do not do that. We just make sure that when we bring you in, we know that you are trainable. And what is the most important factor, I would say, is your internal motivation to become a doctor. That internal motivation is very important. And we have processes to assess that internal motivation, and we bring you in.
I remember being one of the examiners.
Yes, it's very vigorous, but it also allows us to make sure that the people who come into this will be people that we are proud to call as graduates of and alumni of Universiti Malaya. Yeah.
Right. So tell me more about the code of ethics. Is this something that a lot of people know? Especially among our academics, the code of ethics that has been, incorporated in UM since the 1970s. What is that about, and how does that promote a wider range of people, wider diversity of people coming into the university and acting on it?
Yes, I think that's a very important question. And I think if you want to have real conversation, real impact, we shouldn't sugarcoat certain things.
Fully agree.
I feel that this code of ethics, I think more people should know about it. I cannot say that enough. Sometimes these documents are forgotten with all the new policies that we have. But we're still guided by the core values of Universiti Malaya, which is POISE, which stands for passion, oneness, integrity, sincerity, and empathy. And if you want to talk about oneness, that in essence is what our code of ethics talk about, meaning when we want to do, oneness is basically what diversity, equity and inclusivity is about. Meaning that when we make any decision or any service that we give, we do not think of the differences. In fact, the differences are the one that will make us richer and that will make our decision making better. So we embrace differences because in the end, we are one under Universiti Malaya.
Right. So interestingly, I was just reading this book. It's called, I can't remember the title, but it's written by Bell Hooks. So what she said is that we all need to have love ethics. Right. So we need to have love ethics so that we are able to, to conduct ourselves based on those different poised concepts that we're talking about. And I think it's really important to incorporate that in workplaces like these settings, and also to instill these values among our students as well.
Well, I didn't read that book, but is it love, ethics or love ethic?
It has love in the title, but I can't remember correctly what the title is. I'll get back to you, Prof. Yang.
Right. Yeah.
But it's really nice to think about love ethics and how much we have incorporated that in our own system.
Yes. And I think these are also values that we teach all the trainees and students that enter our door. And it is, and in most of our code of conduct or oath, you have this in which you never judge anyone based on their color, skin, race, social backgrounds, social status, and so on and so forth. So if we ourselves, so it is very important that when they come in and they don the professional identity of being a doctor, a nurse, and so on and so forth, that they understand that first we teach them what they have to know here, but all that needs to come and be felt here because that needs to be their values moving forward. So it is, while Universiti Malaya needs to have that code of ethics, but I think we are the professionals in healthcare. We need to truly embody that. Really feel as if no patient will be below the care that they need to have and obtain. I remembered when I was doing my housemanship in Hospital Kuala Lumpur. And we had a number of patients with who were suffering from an addiction to intravenous drug abuse. And they will come with infection of the arteries and creating abscesses. Yes. And it might be easy for the doctors then to feel that I don't want to treat you because this is self-inflicted. And therefore, when I treat you, I am exposing myself to whatever infection that you are having. And I'm exposing my family as well. You have to remember at that time, HIV was very big and it was very much a death sentence then.
Highly stigmatized.
Yes, highly stigmatized. It would have been easy for doctors to have done that, right? If they don't even have to say it, they just can delay treatment or refuse treatment. But they didn't do that. We didn't do that because that's the oath that we took. And I think and that happened in Hospital Kuala Lumpur. But I've seen similar things here in our hospital, in our center. So I think this is something very, very important that we must always inculcate with anyone that enters our door and leave us.
Yeah. So speaking of that, speaking of doors, we've seen that we've opened the doors to experts, not just playing a critical role in research, but also policy, advocacy, and also public health. But what truly sets it apart? Could you share some of the faculty's most groundbreaking research or transformative thinking approaches and defining contributions that have shaped the healthcare landscape today?
I think there are many contributions and impact that has been done. I think first you talk about impact in prevention. I think there's been many policies that this social preventive medicine actually has played a role, as well as the Department of Family Medicine. I think they have also primary care. They have also played a role in prevention. And then in clinical medicine itself, we have had impactful research in cancer research. We've had impactful research, especially in pediatric cancers by our colleagues in pediatrics. And our preclinical research, when they talk about genomics and all the precision medicine research that we've been doing, has really created an impact. Research in infectious disease remains very, very important to our region. And I think that's another impactful research that we're doing. Dengue is one of the important research that also have been done. This country has seen a few viruses and infection that has broke out over the years. One of it was Nipah virus. And I think Universiti Malaya's team was instrumental in discovering that virus and looking at the cure of, looking at how to treat that virus. Happily, we never had another breakout of Nipah virus, but we were able to cull that virus because of work that's been done in Universiti Malaya. And of course, during pandemic, COVID, I think Universiti Malaya and Universiti Malaya Medical Center, Faculty of Medicine, remain very important in coming up with how to treat patients, and in the end, working with people from overseas in creating in trying to curb that disease, that pandemic. Now, do we want to wait for another pandemic? No, of course not. Nobody wants that. But I think Faculty of Medicine, Universiti Malaya and the hospital, we are ready, and we've positioned ourselves well to be the leaders in such incidences. And if another pandemic comes, I would like to say that we will be ready to serve Malaysia.
Which will be our second topic. In our second segment, we'll be talking about COVID-19 and what we've learned about being prepared for upcoming pandemics. So speaking of leaders, you mentioned about leaders just now. As a woman, it's truly inspiring to see more women stepping into leadership roles from.
Oh wow, you are going to hear a lot from me on this.
Yeah, that's what we want to capture for today. You know, especially in medicine, Prof. Fadiba, we've got Prof. April, and then you. Well, leadership has traditionally been male-dominated for so many years. So you've experienced medical education from so many perspectives, as a student here, then a resident, a faculty member, clinician, and now as dean, shaping our future. From navigating challenges as a woman in medicine to leading change at the highest level at the faculty, how have these experiences influenced the values and the vision and the direction of where the faculty is going?
I was a student of Universiti Malaya, proud alumni of Universiti Malaya 1987, 1992. You can now calculate my age. When I first stepped foot into Universiti Malaya, especially the Faculty of Medicine, there is a sense of tradition, there is a sense of legacy, and I think there is a very strong sense of evidence-based decision-making. I think our research and that culture of research is very strong. Whenever we make decision, it is mainly based on data, driven by best practices, and so on and so forth. So that was what I learned. When I was a student, evidence-based medicine was already there before it became a catchword in medical education. So as a student, I brought with me that tradition, that culture, so that even in everyday, normal making decision, it is always driven by data, driven by research. It needs to be evidence-based. So what does that mean? That means that the decision you made never random. They are never random. That's what I've been trained. And when I then move into being trained during my trainee, again, this particular culture of Universiti Malaya that I carry becomes the way how I approach things and how I make decision. And before I became dean, I was head of department of radiology, looking after not just program, but also the service part of Universiti Malaya Medical Center. Now that was very eye-opening for me because it is, as you know, radiology is one of the important service in any hospital. I think any patient that comes in through your door will get at least a chest X-ray over the years of their treatment. So I had to look after more than 300 staff at that time in my department, ranging from the radiographers to the academic staff. So again, you bring in the evidence-based decision making that I've always had in me. So when I move on to become deputy dean, you look for opportunities, always driven by another concept now that has come in: feedback. Engaging with the stakeholders. And I think when you do this, when you engage with people, you listen to what they say, you incorporate what is good, decisions are made based on data, and it's always evidence-based, benchmarking it to best practice. And if you continue to do that, you will not stray in the wrong path. Even if others don't agree with your path, you can be sure that your path is the path of knowledge, the path of data, and the path of best practice.
Because you have evidence to back you up.
Yes, that has always been, I think that's what Universiti Malaya taught me. That is very strong Universiti Malaya, and I think it is a culture that we need to really emphasize on. That and talking, having meaningful engagement with our stakeholders. That's our students, our trainees, the employees or the employers of our graduates. They are our best product. I've always felt as a university, we bring in the best, and they enter the university and they are going to succeed because they are the best. We've already pre-selected them. They're the best. But if we at the faculty don't give our brand to them, then we have not done our job. So we need to, because they're the best, they're going to coast through anywhere. They can do well anywhere. But no, at Universiti Malaya, while you're with us, let us share with you our culture. We'll share with you our tradition, our legacy, so that when you go out there, you're not just a good medical officer or a good doctor, but you are a good Universiti Malaya Faculty of Medicine doctor.
You'll be able to know if someone is coming from UM.
You should
shape them
it's
that
just
way.
The way they talk, the way when they say, what's the evidence in this? I think they should be able to know that's a Universiti Malaya Faculty of Medicine doctor. Yes.
Right. Thank you, Prof. Yang, for sharing these insights. It's inspiring to see how UM has grown from its colonial era beginnings to an institution that serves Malaysia's needs, shaping healthcare policies and training future leaders, and more importantly, addressing the country's unique medical challenges. To all our listeners, each episode would feature a key expert who will guide us through 3 critical issues explored in 3 segments. This is just me wrapping up the first segment. Stay tuned with us for more discussions with our Dean while we take a quick break.